Hello ma'am, today I will going to perform range in motion exercises. First, inform the patient and explain the procedure. So hello po, ngayon po ay gagawin natin ang range in motion exercises na kung saan makakatulong po ito upang maging maganda ang sirkulasyon ng pagdaloy ng inyong dugo. So, after explaining the procedure to the patient, I am going to wash my hands. Then, after washing my hands, provide privacy if necessary. Raise the bed in comfortable position. Place the patient in supine position. Then, stood at the right side of the joint body part to exercise. But, for the demonstration purposes, I will performing the half body of the patient. But in the real activities, we need to perform left and right body part of the patient. Then, proceed to ROM exercises starting from the neck. Flexion, extension, flexion, extension, flexion, extension, flexion, extension, lateral flexion, extension, lateral flexion, extension, lateral flexion, extension, lateral flexion, extension. Then, rotation of knee. Next, shoulder. Flexion, extension, flexion, extension, flexion, extension, flexion, extension. Next, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. Then, external and internal rotation. And then, circumduction. Then, next, elbow. Flexion, extension, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Next, pronation, supination, pronation, supination, pronation, supination, pronation, supination. Next, wrist. Flexion, extension, hyperextension, flexion, extension, hyperextension, flexion, extension, hyperextension. Then, lateral flexion, extension, lateral flexion, extension, lateral flexion, extension, lateral flexion, extension. Then, rotation of wrist. Next, finger and thumb. First thumb, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Then finger, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Then opposition of finger, opposition of finger, opposition of finger, then next hips, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Abduction, 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 abduction. Next, knees, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Then ankle, then inversion, 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 then plantar flexion, dorsiflexion, plantar flexion, dorsiflexion, plantar flexion, dorsiflexion, and then circumduction of wrist, and then for the toes, flexion, extension, hyperextension, flexion, extension, hyperextension, flexion, extension, hyperextension, abduction, 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 abduction. Then, after performing the activities and the patient is in comfortable position already, then going to wash hands and documented the procedures in terms of joint mobility, then patient's discomforts and other pertinent data.